Recognized.
Thank you, Mr. Chairman. Thank you, Madam Secretary, for being here today. And as you know, many Americans are really opposed to the idea of being required to purchase or to have insurance or Washington-mandated insurance. The new health law also requires participating employers to auto-enroll all workers in the new class entitlement program, unless a worker pays very close attention and takes time to opt out of this program. You call the program voluntary, even though some enrollees might not want to join this. So if class is truly voluntary, why did Washington Democrats allow American workers, why didn't they allow all American workers to explicitly opt in instead of being automatically enrolled in this program?
Well, sir, I need to correct something. First of all, there is no program that is together yet. There is no automatic auto-enrollment. That is one of the considerations being discussed, but there is no framework yet for the class program. One of the issues is how to get a take-up rate that is a sustainable program, but there is no mandate for auto-enrollment.
If you do assume that fewer Americans would enroll in class, if you gave them the freedom to opt in instead of forcing them to jump through the hoops to opt out, I mean, what do you think they're going to do? Are they going to opt in or opt out?
Well, again, I think class has the potential of offering Americans a product that they currently don't have available, which is to set aside their own money and pay for residential services, allowing them to age in place. It isn't available in the private market. It isn't available in the public market. We have heard from consumers across the country how incredibly valuable this would be to not be faced with a choice of forced nursing home
no, I understand the benefits of the
home.
program, but let me ask you this. I understand many employers intend to avoid class participation due to what they will foresee as administrative hassles and certainly the projected insolvency of this program. The U.S. Chamber, the President's own Deficit Commission, both have called for repeal of the program before implementation. You recently announced a massive $93.5 million PR program targeting employers. But what's the contingency plan if you cannot pressure enough employers to auto-enroll workers in a program that Democratic Senator Kent Conrad calls a Ponzi scheme? I mean, are you going to have warnings in this from CBO and the Medicare actuary who have expressed, major concerns about future deficits and this program being clearly unsustainable?
Congressman, we very much share the concerns that have been expressed that as written into the law, the framework of the program was not sustainable into the future. The Deficit Commission actually said it should be repealed or corrected.
So should it be repealed?
No, sir. We are in the process of actually correcting the framework so it can be solvent into the future. And so we not only keep the commitment to the American people, but also make sure that taxpayer dollars aren't.
Would you share the information that the discussions you've had with Treasury on this, on the mechanisms for enrollment and how the premiums are going to be collected?
We would be happy to share with you.
And do you know when the first class premiums will be collected?
They're not scheduled to be started until 2012.
Okay. And will it begin prior to the establishment of the class independence benefit plan?
No, sir, because we can't enroll anybody unless they know what it is that they would be setting money aside for.
Okay. Thank you. Mr. Chairman, also, we heard a lot of discussions about delivery system reforms, and we heard vague platitudes by Dr. Berwick the other day to our questioning across the dais here. And I have deep concerns as somebody who has really worked in delivery system reforms and quality issues in that area. And I haven't heard anything specific from you today either. I deliberately avoided the question, but I'm going to send a letter to you in writing requesting a meeting with your experts at HHS to start extensive discussions on this, because clearly this is at the heart of how we really manage cost in this. And I have not heard anything in public or in testimony to the effect that you guys understand what you need to do in that area.
Well, we'd be delighted to have those discussions, and let me just assure you, Congressman, that the delivery system reforms initially are entirely voluntary, are coming to us from providers. This is not something that's being directed by CMS. It is a provider-driven, innovative approach, strategies that are in place and work, and but we'd be happy to have those extensive discussions.
I'll send you a formal letter requesting those meetings.
All right.
Thank you.
Thank you. Mr. Neal is recognized.
Thank you very much, Mr. Chairman. Thank you, Madam Secretary. I want to thank you, first of all, for a productive meeting that you and the staff had with Caritas Christi. You went a long way toward reassuring them of many of the issues that were raised earlier by my friend, Mr. T. Berry. I want to thank my friend,